So very clearly, when we look around, whether it's the US or around the world, there's huge pressures on pricing. And, whether it's rebates and taxes and levies in the United States, and those of you who are in the medical device industry, you've done a very good job at AdvaMed lobbying Congress to try and remove the medical device tax. But let me tell you, on the pharmaceutical side, it's much, much worse. I would think, from my perspective, the costs are probably 2 to 3 times that has fallen on the medical device industry. Overseas, of course, it's a different form of the government collecting money. There it's just a blunt instrument of price cuts, and the same exists in places like Japan, Korea, Turkey, and so on. Then, of course, later on, and we did hear a little bit about that this morning, where we heard about reimbursement. And of course, in many countries now, there's a so-called fourth hurdle, whether it be NICE in the UK, or IQWiC in Germany, or PCORI maybe one day with some teeth in the United States. And of course, the reason for all of this is the backdrop, particularly since 2008, and we saw some data on the flow of venture capital funding since the Great Recession. It's all about tight government budgets. And here, if we really look at the very front end of innovation, clearly we should have our eye on the budgets of the National Institutes of Health, and more particular and of note for us, the budget of the National Eye Institute. And we will hear, I'm sure, from Paul Sieving later on, how this is affecting his operation and how he's dealing with it and what choices have to be made.